Hi, it's Dr. Kevin. We're talking today about what it's like to get diagnosed. Unfortunately, breast cancer is very common, but patients do very well. So you get the call from the doctor or from the radiologist and they say you have breast cancer, and all you hear is the word cancer, and everything starts to fall apart. You start thinking, oh my God, I'm going to die. Oh my God, what about my family? What about my friends? I'm here to tell you that this is not a death sentence, that this is not time to start maxing out your credit cards or thinking about your funeral. This is the time to start planning about what to do next. So the breast cancer survivals back in the 80s were a death sentence. It was 20-30% 5-year survival. Now breast cancer patients do great. If they find it early in the breast, the survival is 99% in 5 years. And overall, breast cancer is more than 90% survival. So that means you're gonna make it through this. And then it's about taking care of you afterwards. What do you do right now? So first thing is call your doctor, because your doctor knows you. You can have a whole conversation about what this means. What I tell my patients is exactly what I said to you, is that this is not the end, but this is the beginning. You have to do some research. So find a good breast surgeon. So breast surgeons are the expert when it comes to breasts. They're the breast doctors. So I always recommend seeing at least 3 breast surgeons to get an idea of what to do next. So a lot of them will require more planning to see what's going on. Maybe an MRI, maybe gene testing for the breast cancer genes, maybe a more extensive biopsy. Those things will show the tumor markers, they'll show where you're at, but ultimately you need surgery, so you need to find a breast surgeon. But if you have at least 3 consultations, you can sort of say, okay, one doctor recommends this, one doctor recommends this. Wait, all 3 say the same thing? Just pick the one that you like the best, because you're gonna have to feel comfortable with what they're gonna do. So if it's surgery, if it's chemo, if it's radiation, those are usually what happens, but all of it is not forever. It's like a 2-3 month journey to get better. And then we take over. We take over taking care of you afterwards. So we're not the experts during the actual treatment, but we can help you definitely afterwards. So I'm just here to say, it's not the end, but the beginning of a new chapter. So you see the breast surgeons, they take good care of you, you find who you're comfortable with, and then doctors like us will help take care of you for the next chapter, life after breast cancer.